Welcome to our Canadian Tourism and Hospitality Institute online lessons. Today our lesson about coronavirus outbreak, safety precaution to staff working at the hotel. I am Karthik. Thank you for joining with me. So what happening now? This virus is a novel. We have less information and spreading pattern about this virus. It's actually started in China, now is almost spread all over the world. The infected people numbers increasing double digit overnight. The travel and hospitality industry is still trying to adjust our operation for this coronavirus outbreak. So so far we have no idea how this pandemic going to affect our industry. And even there are 69,779 were cured from this coronavirus. That is a motivation for us. So as a hotel industry people, what we can do, one thing we supposed to do the management to educate the staff about the symptoms so they may know whether they are affected by this virus. So the major symptoms are fever, dry cough and shortness of breath, but it's not limited. Some people even don't have any symptoms. Symptoms typically occur 1 to 14 days after exposure. So first you have to do as a management, you have to educate your staff about the symptoms so they can isolate themselves once they suspect or they assume they are infected. So that's a main important thing to control the spreading of the virus. So there are three ways the virus may transfer from infected person to others. So it's maybe having a direct contact or the droplets from the infected person. Then it's carried by the air. Then breathe or take it by some surfaces. Then other uninfected person go and touch the same surface and it can be get infected. So these all three possibilities we will have when we doing a hotel operation. So people now researches are still going on, but they found out the different lifespan of the coronavirus in the different surfaces. But still, there will be no 100% sure information. These are the still the researchers having a different find out. But the thing is, if the temperature is high, the lifespan will be shorter, and the humidity is high, the lifespan will be increased. So the critical thing, the person who spread this virus, he started to spread even he doesn't show his symptoms. He before he realize he may able to the person may start to spread the virus to others, and it may happen even he cured after up to 1 day he have a capability to spread the virus. So the major thing what we can now the government also do, we are isolating the people from highly risk coming from highly risk country. Same thing happened those who are having a contact with affected or infected people. So as hotel sector, we are very familiar with cleaning and disinfecting. It's housekeeping people you know well. But we are more focused on disinfecting, especially when you come to housekeeping. we focus on the restrooms, toilets there. But here the case is quite different. We have to focus our disinfecting in all the surfaces may have transmission this virus. So we can reduce or maybe kill the virus through our disinfecting process. So the action should be taken by the hotels. Let's start with the management or the human resource. What kind of actions they can take? They can ensure the staff who are working back to work, or even you are hiring people, they are not come from this highly risk affected country, and they didn't go through this 14 days isolation period. So you have to make sure that sometimes the staff go for holidays, they travel, or they having a very close contact with the friends and relatives come from with high affected countries. So you have to have a special attention of the staff of a certain scenario. And most of the hotel now using a fingerprint machine to uh, take time in time out. So you can having a disinfected facilities, you may keep it disinfected and some cotton wool, so the people who come to thumb in, they can disinfect their self and the machine by them. uh, so the other thing is the staff should use the personal protective equipments given by the management, or if might be a face mask, or it might be a apron, or whatever they have to should ensure the human resource or the management should ensure the staff using their personal protective equipment. Then the staff locker rooms are the another critical area. They can take the things during their breaks and bring to the operational area. So if you have to make sure it's go under deep cleaning and disinfected, and have a close monitoring process. So it's the things can't bring unnecessarily in chances of virus to the operational area. And another most important thing is maintaining the records, because when the cases are identified, the suspected or infected people are identified, we need to trace it out. Who will be involved? Close contact with them on the service, or so any kind of information to find it out that people to isolate it to they are not further spreading more. So for that, for example, you have to having a CCTV footages, and even you may having, if you are a guide, so what are the room number of guests you bring them for a tour, or if you are a driver, hotel vehicle driver, then you can have records those rest you bring them on the dates. So when you're giving a service, you have strictly instruct the staff to keep maintaining a social distance, avoiding handshake. You can bow or say vanakkam, put your hands together. So these kind of things you have to ensure the staffs are maintaining the sufficient social distance. Then you have to put some signboards to encourage your staff to wash hands and disinfect hands frequently. So the most of the time advise the staff to not to touch their face uh, unless they are without washing their hands. So that's most humans we having a habit to touch our faces. So we have to change that habits. We have to, when you want to touch your face, we have to di- use the sanitizer papers to wipe our hands, and then we have to do that. So the all people and some other medical complication people in the service must be protected, because when it's spreading the coronavirus to your staff, these people are highly risk people facing deaths. So you have to make sure these all people and 6 people on your service crew to not affected or infected by this virus. And if it possible, you can use a thermal scanner for your staff, guests, and suppliers when they in and out. You can use it, and this process can help to screen some infected people. Then when we look into the housekeeping again the same thing is the personal protective equipment is most important while they are doing their duty. Uh, while cleaning with the staff, especially for occupied rooms and all, they have to having a certain distance, don't have a very close touch with your guest, and sometimes the guest may be having a self-isolation, like they suspected, they assume they may have this kind of sickness but not confirms it, so you are don't go very close to them. And other thing is rather than cleaning and disinfecting, the laundry sheets are like a hotel. We are changing bed sheets, duvet covers. So this virus can be easily wash it out by normal laundry procedure. But the problem is we don't need to mix with the clean linen with dirty one. The dirty line may have some infections. In case if you mix it down or use like shake it and you have to spread it through the air, then the clean one may also having an infection. So the cross contamination between the clean and the dirty linen should be avoided. Mm. And the public area, make sure the disinfection should happen to this lobby area and highly people moving and touching surfaces like a front desk, lobby table, chair, front doors, handles. This all should be clean and disinfected frequently. Room attendant, when you are cleaning a room, especially focus on these following areas: television remote, AC remotes, door handles, bathroom door handles, cupboard, windows handles, electric switches, minibar. So these are the places definitely the occupant going to touch. Then the front office, having you have frequently clean the lobby reception surface with disinfectant. Don't wait for the housekeeping, so you can disinfect as if you are free. Then make sure your landline phone and fax machine switches are disinfected. During the welcome process, you can ask the guest to use the disinfectant to their hands. So the hands make sure the guest not carrying any infection outside to your hotel. Guest key cards should be sanitized to before give to next guest. Maintain social distance, of course, avoiding the handshakes and mm, unnecessarily touches with the guest to avoid the spread of the virus. Let's say if you took the passport or credit card, after you have to possible you can have a small disinfectant disinfected your hands. Lift or elevators, you can frequently disinfect the buttons, or you may put a operator, so it can help on that scenario. So you can collect the information about medical condition and the information about the travel history, information about the guest. Table layouts for the food and beverage department. If you come table layout to the restaurant, take it as much as spacious, so it's not in case of the corona infected person not spreading the virus to others. Avoid cash transaction. Two things, because cash can be carry the virus. Still, the card also can be, but the possibilities little bit less. and cash. We don't know how many people handle this. And even let's say if you want to trace it out there, because we don't have any record of restaurant guest who's visiting. So if you're having a credit card information, so we may trace it out in case of some disease spread. Use water bottles because some kind of banquet events and all, you can sterilize the glasses. How it possible, I'm not sure. If it comes 100,000 to 1000 packs, so better go for directly water glasses. If you are serving a traditional food, avoid cutleries because sterilize is difficult. And if the guest is in the room, encourage room service. If they found guest with a symptom, the staff may found just uh, inform to the management, so the management will do the further actions. Our industry is very resilient and we always bounce back stronger and better. Thank you.